My breast cancer journey started in June when I felt a lump. My name is Kelly Morrow. I'm from Kalispell, a retired teacher, and I never do self-exams. I'm not sure what possessed me to do it, and I felt a lump and went, what is this?
So before I met Kelly, she had already had surgery, and then we recommended chemotherapy. So she started chemotherapy as planned, and then she had an infection complication that resulted in her being in the hospital.
Once I got through the diagnosis, which it was a pretty dark couple of weeks, it's very scary because I'm not done with my grandbabies yet. So I wasn't ready to be done. But the scariest after the diagnosis was when I was septic.
Sepsis is an infection within the body, but it's almost more than that. It is an infection that's starting to affect the organ function. Sepsis in an oncology patient is what we consider an oncologic emergency. These patients are already immunocompromised, either because of the cancer or because of their treatment from the cancer. And we need to find out what that microbe is and start them on their antibiotics.
I was the charge nurse, and she comes in, and as soon as I see her, I clearly see a very sick individual. She's weak and just not doing well. I'm like fluffing her and put her in her little burrito and trying to do my best to make her comfy, and she's just graceful. No, it's fine. I don't even need a blanket. I don't even need a pillow. I think that was a meaningful moment for me because she was very, very sick and just so kind and graceful in that moment.
It was MRSA, which I know enough about to go, great. Because I had the same day nurse the whole time I was here after that expander was removed. He goes, yeah, it is scary. It's also manageable, and they were able to get the infection out. But there were a lot of compassionate moments. But that would be one where he just could tell that even with my knowledge, it was a scary thing. And he's like, it's okay. It's going to be okay.
Certainly, I think what comes to mind when I think of Kelly is her truth telling and her humor. She had a few hiccups during some of her oncology treatment, and so that was why she ended up diverting to us for a few weeks. Despite all that, she always was able to find a way to, laugh about something or find the way to make the best of it.
The term breast cancer is a pretty generic or broad term, so there's a lot of different subtypes of breast cancer, and the treatments depend on the details of the specific subtype. She's an interesting patient because she had a couple of different tumors, and they were all a little bit different. We came up with a treatment that covered all of the different aspects of her cancer. So for breast cancers, treatment can be immunotherapy, it can be chemotherapy, it can be anti-estrogen type treatment. So there's a whole range of ways that we would treat a breast cancer.
What we do when we're giving her particular chemotherapy treatment is not friendly and nice. It's not a pleasant time, and she's just a class act and just radiates positivity and kindness.
I think a positive attitude is important. It's hard sometimes not to go in the dark places. One of the things that I've noticed through this whole process and journey is there's a lot to be grateful for. There's so many people that go through a cancer journey that don't have the family and community support. I'm humbled at the support and love I've gotten. I've had former students bring food to the house, reach out to me with little notes and Facebook messages. So I think it's easier to stay positive when you're surrounded by the amazing love and support that I've been surrounded by. And the alternative doesn't work for me. So that's how I stay positive.
I actually worked with Kelly in the hospital infusion, administering her antibiotics, and then I've also given her chemotherapy once she finished her antibiotics. Getting diagnosed with cancer can be a really big, life-changing, scary thing. And when patients come to us, it can be really overwhelming because they've received a lot of information. And so we really just try to put them at ease, make sure they understand what's going to go on, even just giving them a quick rundown of what to expect the next 2 hours just to ease them.
We try to help people get comfortable right away. As most hospitals are, it tends to be cold, so one of the first things we like to do is offer a warm blanket. That can be really helpful and reassuring to them.
I prefer using the term no evidence of disease and cancer-free because remission implies it's still there or just waiting to wake up again. I'm not going to buy that. So my mental state is, and my oncologist said no evidence of disease, so I can go with that. And that's just how I'm moving forward, is the systemic chemotherapy, got it. And now the rest of the things are just insurance policy. I'm looking forward to normal, whatever normal might mean. And it's going to be different. I do have the lymphedema, so I'm having to manage that with daily routines. So I've got grandkids that live south of Helena, and I've got grandkids in Columbia Falls. We had our first sleepover since my diagnosis just this week. That's what I'm looking forward to, is those interacting with my family and friends, and to travel. The care has been amazing, and I appreciate the smiles and the humor and the kindness and the knowledge. Bottom line, I'm really lucky that I live here, where this medical facility and the people in it are available to me.